Before we learn more in detail about the cardiovascular system between males and females, what is cardiovascular system? The cardiovascular system uh, includes the heart, blood arteries, and blood, crucial for preserving homeostasis by supplying oxygen and nutrients and eliminating waste. There are sex-based variations in the morphology and physiology of the cardiovascular system, despite the fact that its fundamental structure and function are the same in all humans. Health, disease presentation, and medical treatment are all impacted by these differences, which are influenced by hormonal, genetic, and environmental factors. Men's and females' cardiovascular systems are different because of men's bigger body mass and muscular composition. They are often characterized by larger hearts and higher blood volumes. Testosterone has a major effect on cardiovascular dynamics by affecting lipid profiles and raising resting blood pressure. Men frequently get cardiovascular problems earlier than women due to these reasons. Estrogen protects female by lowering lipid profiles, decreasing arterial stiffness, and boosting endothelial function, especially before to menopause. Females often have slightly greater resting heart rates, smaller hearts, and narrower blood vessels. The drop in estrogen levels following menopause raises the risk of cardiovascular diseases such as atherosclerosis and hypertension.
Gender-specific indifference in cardiovascular health. In men, the heart and left ventricle are larger on average, mainly due to greater body size and higher muscle mass. The left ventricle, which pumps oxygenated blood to the rest of the body, is proportionally larger, allowing male to pump more blood with each heartbeat, high stroke volume. This translates to a greater cardiac output, the total volume of blood the heart pumps per minute. For female, the heart and left ventricle are smaller relative to their body size. This results in a lower stroke volume and cardiac output. Despite this early difference, females maintain adequate oxygen and nutrient delivery to their bodies through slightly higher heart rate, which compensate for the smaller stroke volume. Heart rate. Males typically have a slower resting heart rate ranging from 70 to 72 beats per minute. During physical activity, their heart rate response is also slightly slower, which aligns with their larger heart ability to pump more blood with each beat. Female, however, exhibit a higher resting heart rate, average 78 to 82 beats per minute. This compensates for their smaller heart rate size and lower stroke volume. During exercise, their heart rate rises slightly faster, reflecting the need to maintain blood flow and oxygen delivery efficiently. Symptom of cardiovascular issue. Males often experience classic symptoms like severe chest pain, usually localized on the left side. This pain typically occurs during exertion or when the heart is under significant strain. They are also more likely to experience shortness of breath during physical activity and in some cases nausea. Their larger arteries make cholesterol buildup easier to detect with standard tests, which can identify blockage more readily. Female, on the other hand, may not exhibit typical chest pain. Their symptoms are often subtler, such as a fatigue, shortness of breath, or discomfort that radiates to the back, neck, jaw, or stomach. These symptoms may occur even without physical exertion, making them harder to recognize as heart-related. Nausea is more commonly reported in service cases. Additionally, females have a similar arteries, which are more challenging to evaluate using standard tests, and inflammation play a more significant role in their cardiovascular health.
Gender-specific difference in cardiovascular according to lifestyle between male and female. First, sleep and rest. Men are more likely to suffer from sleep apnea, a condition that can disrupt their sleep and can negatively impact cardiovascular health. Factors such as obesity, smoking, can exacerbate the risk of sleep apnea in men, highlighting the interplay between lifestyle and health. Women, on the other hand, are more prone to insomnia. This is particularly evident during periods of hormonal change, such as pregnancy, premenstrual syndrome, and also menopause. This sleep disturbance can also increase cardiovascular risk, making sleep hygiene a critical area for attention. Next, physical activity. Men tend to engage in more vigorous physical activity which has positive effect on cardiovascular health. These activities improve heart function, reduce body fat, and help maintain healthy blood pressure and cholesterol levels. While female women are less likely to engage in regular vigorous exercise, which increase the risk of obesity, hypertension, and diabetes, which is some of the keys factor contributing to cardiovascular disease. Other than that, we can talk about dietary pattern. Men often consume diet high in unhealthy fat, red meats, and processed food, which are major risks for heart disease. While women are more likely to eat fruit, vegetable, grains, but their diet can be higher in sugar. Nutritional needs for women are heightened during pregnancy and menopause, making proper dietary choices crucial. Last but not least, smoking habit. Men have higher rates of smoking. They tend to start smoking at an earlier age and often have higher daily consumption. This causing significant damage in men, leading to increased blood pressure and arterial stiffness, which are major contributors to cardiovascular disease. While women are more likely to less smoking than men historically, but now are closing this gap. They can face similar health risks to men. Furthermore, smoking during pregnancy can increase the risk of preterm birth, low birth weight, and gestational hypertension, which can have long-term cardiovascular consequences for the birth mother and child.
Next, we continue to the hormone that influence cardiovascular disease. Okay, the first hormone is estrogen, which is mostly we can find in women. Estrogen has protective effect against cardiovascular disease. After menopause, declining estrogen level increase the risk of CVD. Okay, the first disease is coronary artery disease. So how it happen? Increase the risk of coronary artery disease, higher LDL cholesterol, which is bad cholesterol, and lower HDL cholesterol, which is good cholesterol, leading build-up of plaque in arteries. Next, hypertension. Hypertension, increased blood pressure, contribute to hypertension. Third, heart failure, lead to increased cardiac dysfunction, heart failure risk increase. And last, stroke, change in plaque characteristic, increase arterial stiffness. Besides estrogen, there are several hormones that influence cardiovascular disease. For example, testosterone. Testosterone mostly finds in men. Effect of low testosterone, increased risk of coronary artery disease, association with metabolic syndrome, and poorer outcome in congestive heart failure. Okay, next, cortisol hormone, high blood pressure, hyperglycemia, which is high blood sugar in body, obesity, weakened immune response. And last one is leptin and adiponectin. Imbalance of these two hormones can contribute to obesity-related cardiovascular disease. Every hormone contributes to the control system in the human body, but can cause disease if the hormone level are insufficient or excessive.
So, I'll be sharing with you guys about the gender specific difference in cardiovascular disease according to genetic predisposition. For male, some Y-linked genes like UTY can affect inflammation and blood vessel function. it will increasing men's risk of cardiovascular disease. Testosterone may enhance pro-atherogenic pathway, potentially increasing the risk of cardiovascular disease. It can also influence the expression of genes regulating vascular tone and endothelial function. Men often have a greater tendency for inflammation in the body, partly influenced by specific genetic factors like IL-6 genes, which regulates inflammation. Lastly, male more likely to develop heart failure with reduced ejection fraction. Moving up to female, women have two X chromosomes which can compensate for mutation through X inactivation escape. Certain X-linked genes like XIST and PSIX may protect women from cardiovascular disease. Estrogen has protective effects on the cardiovascular system, enhancing nitric oxide production and modulating the expression of genes involved in lipid metabolism and inflammation. Women's immune systems tend to respond more strongly to infections and injuries. This is partly due to certain genes on the X chromosomes like TLR7 that help fight infection. Lastly, for women, females often present with heart failure with preserved ejection fraction.
Hi guys, this is for the conclusions. So this conclusion is about the gender specific difference in cardiovascular health. Risk factor and disease presentation are fluid by the hormonal change, lifestyle factor and genetic predispositions. In female, we know its estrogen provide protective effect before the menopause, while its decline increased cardiovascular risk. And for male, are more prone to early cardiovascular events due to higher visceral fat and lifestyle factors like smoking. Genetic predispositions such as familial hypercholesterolemia impact both gender but may manifest differently. These factors contribute to variation in disease prevalence, symptom and outcome require gender-specific prevention and treatment approaches. Hi guys, this is for the slide for fun fact, and this is for the cardiovascular health title. And first point is heartbeat. The heartbeat is around 3 million times in the average person life. For the second point is about the blood cell. Is the blood cell 10 million billion blood cell die in the human body every second, and the same time numbers are born for the second. And for third point is it take about the 20 seconds from red blood to circle the whole body. And last point is about the which is a teeny droplet of blood. There are some 5 million red blood cells. This is last slide for the reference. So thank you for watching our video, and don't forget to like and subscribe, and thank you so much for our madam. So thank you, bye bye.